So I'm going to talk a little bit about yoga, breathwork, and stress reduction in ovarian cancer, and kind of explain a little bit about, just talk a little bit about how I got involved in this and how it's helped me and hopefully how it'll help you. So briefly, we're going to talk a little bit about literature in yoga and cancer care. Unfortunately, there isn't a great amount of data in ovarian cancer. Breast cancer really has most of the data. Discuss the philosophy of yoga therapy and approach to treatment protocol design. And this is very different than your other talks this morning, so hopefully you'll find this interesting. And then we'll enjoy and practice some breath talks together. I'm not going to spend a whole lot of time, but I am going to explain how I ended up here. And definitely for people who might have known me 20 years ago or so, Dr. Lucci's in the audience. I would say I'm not a yogi. I'm a wannabe yogi. I want to try over and over again to kind of get back to knowing what my center is, what my intention is, and I continue to work on it. And it's just part of being human. It's something that we all have to do. But there are certain things, practices that we can do that can help us all. I did somewhere in the middle of my career, because I've been at MD Anderson now for 25 years, I think I started to feel a bit burnt out. And it definitely takes a toll doing this kind of work every single day. And so for me, looked in a number of different places to find a center and a way to kind of ground myself so that I could get up day after day and talk to people about some of the really serious things that we talk about. And I found kind of my answer in yoga. Initially started with just kind of some 200-hour yoga teacher training, then a 300-hour yoga teacher training. And what really helped me was there's a woman named Smita Malia, who is a yoga therapist at MD Anderson, who does most of Lorenzo Cohen's work in the Integrative Medicine Center. And she's a yoga therapist, which is a little different than a yoga teacher. And I did her training, which was 3 years of kind of 1,000 hours of learning a little bit more about the philosophy. And that's where I got there. And I put those other two people in there because I think it runs in my family. We have a couple of cousins who run Bhatki Fesk and teach Iyengar yoga. It might be genetic. So you guys have heard a lot about kind of the immunology and some of the things that we are targeting in cancer care. And this really all comes back to kind of the sympathetic and the parasympathetic nervous systems. This is very basic stuff, but you've heard sympathetic is fight or flight, and parasympathetic is rest, digest. And these are things that are important, right? Like when I realized that I finished my yoga class this morning at 11:30 and I had to get here at 12:10, I needed my sympathetic system to get me dressed and get all the way over here. But if I stay like that for the rest of the day, I'm going to do some damage to myself. So stress definitely affects the body, and Anil is here and has done a lot of this work, and you guys heard of talks before, but it affects you, just physically. Your neck hurts, you're grinding in your teeth, you get headaches at the end of the day, everything feels tight, but it also affects you on a basic science level. And we were just talking about cytokines and interleukins that can be affected and targeted. But what I want to talk about a little bit today is that I think we have kind of an innate beta blocker, an actual anti-stress tool that we are already born with that we can use if we remember to do it. Everybody knows that if you slow down enough and somebody walks you through a little bit of a breath session, that all of a sudden you feel better. And you just forget that you have that at your access at all times. So I'm not going to spend a lot of time on this. This isn't a basic science talk. I'm not going to pretend to make it one. But there is good data out there, most again in breast cancer, that talks about how we can do yoga and other mindful techniques and reduce some of these inflammatory markers that can do real damage. And we are working on developing targeted therapy towards these, but maybe we can do a little bit of ourselves. It's not just about a pill or a shot or chemotherapy. So this is a randomized study in breast cancer, and it actually took 200 breast cancer survivors, and they randomized them to 12 weeks of 90 minutes twice per week, and that's a lot of yoga classes or weightless control. And then what they ended up showing is that it wasn't just even doing the yoga. So the yellow line on the top is the control group. The middle line is people who did at least 18 minutes a day of some sort of stretching yoga, and up to about 29 minutes to 30 minutes is the higher group. And what you see is that the amount that you were able to do and really kind of get into this area reduced your fatigue level. That's the top. So you have this fatigue is this graph. This is vitality. This is depression symptoms. All improved significantly if you were able to practice regularly. And this, just a little touch, is your IL-6 inflammatory marker, TNF alpha, and then I think that's interleukin 1 beta. So anyway, the idea is that there are just beginning to be some some good studies that show that we actually can control some of this ourselves. The research is out there. Lorenzo Cohen is on this. He's integrative medicine at MD Anderson, and there are multiple studies looking at the review studies looking at what yoga has done for specific cancer patients. This is just one of them, and this is just to give an idea, running from 1975 to 2017, these are the number of yoga clinical cancer trials happening over time. This is not a new science, this is an old science that we're rediscovering. And if you look at kind of in general the outcomes, this is kind of giving you a little idea about outcomes during treatment, post-treatment, and combined, that you see significant blue bar results for quality of life during treatment, physical quality of life during treatment, physical and psychological, and then you see probably the most in physical, feeling, how you feel, your energy level, your fatigue level, all of those things seem to be improved. I want to just make, I'm not saying that you can't do a yoga trial, but I think doing a yoga trial is very different than doing a clinical trial. It, to me, always seems somewhat easy to do a trial. I'm not dissing any of you guys, but to measure a tumor response to a chemotherapy treatment is pretty exact, right? You measure the numbers and then you see that it shrinks. We do try to do quality of life in both yoga trials and tumor response measurements, and we look also at toxicity for both. I mean, you don't really want to have everybody standing on their head if they've got specific issues with yoga. But really what the benefit of yoga is hard to measure. It's hard to measure open-heartedness. It's hard to measure interconnectedness. It's hard to measure, like, how do you say I feel more connected to my true intentions? And it's hard to account for selectivity. And I've got Elvis up there because I'll give an example. I can go through, and I went through this right when I was starting doing some yoga. I did this whole yoga class. I did all the work, and you get to Shavasana where you're laying on your back, and they put on Only Fools Rush In, which was my first wedding song. And I was like, I just did all of this work and it's all gone. So I would say that one of the things that's important to know about what we're doing is that words cannot convey the value of yoga. Iyengar said this, it has to be experienced. So in ovarian cancer, there's not a lot of data. This is actually it. This is all I could find on a lit search. So yoga during chemotherapy, only they approached 17 people. Only 7 people agreed to do sessions. They did only 15-minute sessions, and they focused on awareness, breathing, and movement. And the goal of the study was to look at feasibility, and it's kind of up to you to decide if 7 out of 17 is feasible, but it's rough. During treatment is definitely rough. I have a trial going on right now with cervix cancer patients during their treatment, and it's really hard to accrue to that. Exercise and yoga, this was just a cross-sectional study where they looked at people who participated in exercise and yoga, and they showed that people who did both had better physical functioning, less pain, better emotional health and vitality. And then restorative yoga, this was 37 ovarian patients, 14 breast cancer patients. And again, they showed significant improvements in depression, anxiety, mental health, quality of life. So this has become so important that the NCCN, the National Comprehensive Cancer Network, in 2019 actually incorporated yoga into the recommendations for cancer patients. So specifically, they focus on it in preventing nausea during treatment. They do it for fatigue-related issues, and I think I thought I put a little red line in there somewhere, but if mindfulness-based techniques are definitely recommended. There it is. I thought I had a little red line there. Oh, there it goes. And then in 2021, also in survivorship for anxiety, depression, trauma, and distress, consider referral for integrative medicine for all of these. And they would not do this in the NCCN without good data to support it. Cancer pain, also a lot of mindfulness techniques are useful. And lastly, ASCO also has endorsed the SIO, or the Society of Integrative Oncology clinical practice guidelines, to incorporate yoga into the co-management of symptom management for cancer patients. So what is yoga? It's not this, although it might be for some people, and so nobody's going to ask you to do that. But yoga has a number of different ways of explaining it. I think the one that I like the best is kind of this one, which is from Patanjali, who may have been one person, may have been many people, somewhere around maybe 500 AC AC. Yoga, chitta, vritti, nirodha, which means yoga is controlling the disturbances of the mind. So it's kind of like when you are freaking out, how do you calm yourself down so you can see clearly? And that's really what it's about. There are 8 limbs of yoga. It involves a whole lifestyle. Yoga is not just the movement that we do in the West. It involves behaving in a certain way. And I put like the do's and the don't do's, the yamas and niyamas. So just as an example, do no harm, don't lie. Those 2 things can be difficult to kind of philosophize about even from the beginning. Self-study, surrendering to circumstances. Asana, or the movement practice, is number 3. Pranayama, or breath practice, is number 4. Pratyahara, which is the withdrawal of kind of all the things that are kind of like squirrels and lights and music, and trying to come back into your inner sounds. Dharana is concentration, dhyana is meditation, and samadhi is absorption in your true self. I'm going to skip ahead just a little bit because I want to just talk a little bit more about this and get to our practice. So the difference between a yoga instructor and a yoga therapist: a yoga instructor just is somebody who's done at least 200 or 300-hour training. Usually they are certified at a national level as well, and they are taught to kind of give group practices, not really specifics for any person, but may be able to give some modifications. A yoga therapist actually has kind of revived my, they helped me remove my burnout, because it reminded me while I went into medicine. So when you are a yoga therapist, you look at a patient kind of the way we did in the very beginning. You think of a person as having multiple sheaths. The outer sheath is their physical sheath, and that's the one we learned about in medical school. Their next inner sheath is their kind of energetic sheath, and you might be thinking of them as, are they having trouble with inertia? Are they feeling, it might have something to do with their emotions. It may have something to do with maybe they're kind of like me, like kind of a energetic, fiery person who tends to get fiery sometimes. And then the manamaya kosha is your mind, which is what the yogis think causes all of our problems. So the mind makes us stressed, then we act on it. Maybe we eat a whole pizza because we're stressed. And then the next one is the Vijnanamaya kosha, which says, you know, maybe you shouldn't have that pizza because you have diabetes, and maybe you should think about that, and you really, what's your intention? And then the Anandamaya kosha, your blissful body, is the one that maybe you get to see a peek of after a yoga class when you're lying down in Shavasana. There are aspects of physical care that are practiced for each one of these areas. So physical, you work on loosening practices. Today, I do a class at MD Anderson. They do 3 classes a week at MD Anderson through integrative medicine that are free. If you're a patient there, from 10:30 to 11:30 on the internet, you just sign up through integrative medicine, and they offer loosening classes. And they're really designed specifically for the patients and their specific issues. You may do some breath work, which we're going to do in a minute. You may talk about some yoga sutras or yoga thoughts that help you reset the way you're thinking, and for some other people that might be prayer. And then maybe some self-study. It also tries to help identify causes of suffering, like things that you really want that you think will make you happy, or things that you really hate that you think if you could just get rid of, you'd be happy. Or the one that we're all here for is the clinging to life, right? So pranayama, that's what we're going to talk about for the rest of the time. That's breath work. Prana and ayama. Pranayama. Prana is the vital life energy. Ayama is the expression or stretching that out. The yogi saying is, where the mind goes, the energy flows. And so what you meditate or think about all the time, so you become. And so if you're agitated, you may notice that you're breathing very shallowly. And if you're relaxed, you may be breathing slow and deep and using your abdominal muscles. It's not easy to regulate the mind, but one of the tools that we can use is our breath. The Hatha Yoga Pradipika is a 15th century text that says, as long as there is breath in the body, there is life. When the breath departs, so does life. Therefore, regulate the breath. This guy's not, I think it's, what's the name of the show? I forget the show. Yeah. And so he's obviously not relaxed. He is losing energy or prana, which is what I tell my 16-year-old all the time. I'm like, you are sucking the prana out of me. So you want to relax, you want to breathe slower, you don't want to drain the energy that you have, because then you have to spend time trying to rebuild it. So if unconscious manipulation of the breath, that like catching your breath when the doctor tells you something, or maybe yesterday when I was getting my own mammogram and I'm like, really, it's 3 more hours? But when that happens, you have to begin to slow down your breath. So why learn it? There's a physical reason. Parasympathetic will override your sympathetic. That's your goal. You're wanting to increase your vagal tone, which will lower your heart rate. Try it for yourself. It will improve your heart rate variability, which is definitely associated with a healthier life, a healthier physical life. It decreases difficulties with sleeping. It decreases hypertension, and it can, for some of you guys in the room, decrease hot flashes. And there's some cooling breaths that we could go through at some point. So the yogis also say you have to breathe slower because you're only given so many breaths in a lifetime, right? So that's why, this is what they say, the rabbit only lives 8 years because it breathes 60 times a minute. And the tortoise, who only breathes 4 to 5 times a minute, lives 200 to 300 years. Humans actually breathe somewhere around 10 to 12, and there actually is this sense that the ideal respiratory rate for relaxation is approximately 6 breaths per minute. So we're going to do a breath work right now, and if anyone has atrial fibrillation, it's going to be really hard for you to do that, so I apologize in advance. So does everyone know how to take their pulse, which is a great thing to know how to do? So there's a couple ways you can do it. I like to do it with my, with my left hand coming around the bottom of my right hand, and then I reach my fingers around so that they're right under my thumb. That you see those kind of muscle tendons right here, you're going to be right next to them. And that's your radial pulse. So see if anyone can give me a thumbs up if they can feel that radial pulse. Awesome. And then the other way that might be a little easier for you is just to take your left hand or your right hand and kind of find this crease in your neck, between your neck muscles and your chin, and then find your carotid artery. And those are the ways to do it. Whichever one works for you is best. I like to actually use this one. And so what we're going to do is just do our own breath work, and you're going to find one that works for you. It may work, what I suggest, or you may have to do a different one. I'm going to suggest that you breathe in for 4 heartbeats, hold for 2 heartbeats, and then breathe out for 4 heartbeats, and then hold again for 2. If that feels like too long, you can adjust it, but I want you to work on it, and then I want you to notice what happens, and we'll just do this for about 30 seconds. So go ahead and find your pulse, close your eyes, set your head to stack right over your shoulders and your shoulders right over your hips. So sit up straight. If your feet are crossed, maybe put your feet flat on the ground. And then before you start really measuring, just go ahead and take a full, deep breath in. And then a full, deep breath out. Do that again. Notice the temperature of the air as it goes into your nose. Maybe notice your nose hairs or the hairs on your upper lip move as you breathe out. And if you can, continue to breathe through your nose and start to bring your attention to your pulse. And try to breathe in for 4, hold for 2, breathe out for 4, and hold for 2. And if that seems too short, expand it to 6, 4, 6, and continue doing that. And as you do it, notice the slowing of your heart rate. You may need to adjust. And just continue for a few more moments. If you can, begin to expand your pause at the top of your breath. No tension there, and then the pause at the bottom when you're an empty vessel. And slowly open your eyes. And notice if you feel a little bit different than when you started. And know that you always have that tool, your own inner metronome, to kind of test how you're feeling, That's a great one to do on a regular basis and to work on expanding your capacity, your inhalation, your hold, your exhalation, and your pause. I will end after one more that we'll just do maybe 4, maybe 3 times. Some people call this the Andrew Weil breath work because Andrew Weil does this a lot. He runs the Arizona Integrative Medicine Center. And so this one we'll do a little different. We're going to breathe in for 4. We're going to try to hold for 7. That's a long hold. And you're going to exhale through your mouth for 8 seconds. So we're aiming for that 1-to-2 ratio of inhalation to exhalation. It may help for you to put the tip of your tongue on the ridge behind your teeth as you exhale. This is a wonderful way to fall asleep. So let's all do it together. We're going to close our mouth. You're going to inhale deeply, full, deep breath in for 4, 3, 2, 1. Gently hold, keep your body relaxed for a few more seconds. And then open your mouth, blow out. Take another full breath in for 4, 3, 2, and 1. Hold it. And then open your mouth, let the same volume of air out much more slowly. Last time, inhale, 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 hold. Open your mouth, exhale, exhale, exhale. It's a wonderful technique. I will say that it is easy to be a yogi in the Himalayas. It's much harder when you have to talk to people. So the whole practice is to kind of learn how to manage the waves. And this is another yogi part from the sutra. It says that the way you keep going is that you continue the practice with some detachment to the outcome. So you continue to work towards your goal, knowing that it might not work out the way you want. And then you accept what comes, but know that you have continued to try to get there. And that's the end, so I appreciate your time and glad that you guys did that before eating. And I think it's time for a panel/lunch. I hope I didn't take too much time.